Hello, everybody, and welcome to the Tuesday edition of Video Clips. And before we get into today's topic, I just have a couple of announcements to make. Our conference is coming up November 11th through 13th, and we have a couple of spots left. Normally, we're sold out by now, but there are some issues with Canadians coming in across the border. And some Canadians who normally join us are not going to be here this year. So I've got a couple of extra tickets if you want to join us. And we have an all-star cast. You can go to our website at WellnessForumHealth.com. You'll see the conference button right there. You can just take a look at the speaker lineup. And I think you're going to want to join us for this incredible event. Second thing, Optimal Health and Life with Pam, Part 1 and Part 2. Part 1's coming up soon. That is the first weekend in November. That's not this weekend, but the next weekend, right? So we've only got a couple spots left. I always get oversubscribed for these. Last year, we had enough to do a second weekend, but I just don't have any weekends. So we're just going to do it one time. So if you don't do it this year, we wait till next year. And we cover all kinds of great stuff, from how to build your immune system to how to manage your time. I share with you my food journals and my meal plans and everything that I do. Not that you have to do everything just like me, but I'm pretty good at this stuff and I can help you be good at it too. So, you know, it's a great Friday night, Saturday morning, Saturday afternoon boot camp, all done virtually with Zoom, so you can participate from anywhere. And then the second one, I haven't done a part 2, but by popular demand, I decided to do it this year. And the agenda for that one, which is the first weekend in December, same time frame, Friday night, Saturday all day, how to increase your metabolism, promoting better immune function, cognitive health and aging, healthy skin, hair, and nails, mental and psychological health, and forming and maintaining optimal habits, okay? And then the last thing, I just came up with this, again, by popular demand, which is a new thing for people who are interested in business development. So if you sign up for a professional course, there is, it costs a lot of money to do professional development programs. So I thought what might be helpful for people is some type of sample class, right? So this is going to be a 3-class series. The dates are December 1st, 8th, and 15th at 8:30 Eastern Time p.m. Each class 2 hours, going to record them. We record everything. So if you can't join us live, you get a chance to do it, to watch all the information or get all the information later. And here's what we're going to cover. Research basics, nutrition and lifestyle, habit change, clinical skills, and business basics. So in other words, it'll be a sampling of what the entire curriculum is like for some of our professional development programs. Then you can decide if you want to go further. And if you do, the $249 that you pay for this course can be applied to anything in our professional development repertoire. Okay, so if that interests you, then send me an email at pampopper@msn.com. I can send you the details, and it might be something to consider. It gives you a chance to study with us, and I promise you'll learn enough from just these 3 classes that if you never take any more classes from us, you'll be better at whatever it is that you're trying to do that's related to being in business for yourself. All right, so on to today's data. All right, so a little bit of history is required in order to tell you about what I have to say today. So in 2017, this goes back 5 years, the American College of Cardiology issued new guidelines concerning which Americans qualified for a diagnosis of high blood pressure. As a result, the number of men under age 45 who qualified for a diagnosis of high blood pressure tripled, and the number of women who qualified for a diagnosis doubled. So this is very good for drug companies. Now, to translate this into numbers, the number of adults who had hypertension, according to the new guidelines, rose from 72 million to 103 million people with the stroke of a pen. This is some of what I was telling you about last week, with guidelines being influenced by drug companies, from John Abramson's book, Sickening. And the number of doses of drugs needed to treat the new target increased too. Almost half of American adults and 80% of adults over age 65 qualified for diagnosis and treatment, a bonanza for drug companies. Now, the expert committee reviewed over 1,000 papers, it said, but the SPRINT trial was cited as the most convincing for lowering the threshold. Now, the SPRINT study followed 9,361 of the most hypertension patients age 50 and older who were randomized to two groups. The goal for one group was to lower systolic pressure to below 140, and for the other group, the target was 120. Those in the lower target group were given an average of 2.8 pills per day and placed on multiple drugs, most of them. Now, it was described as a landmark study that would change cardiology. The researchers reported that the patients in the lower target group were so much better off that the study had to be halted early because it was unethical to withhold the aggressive treatment from the patients, all of the patients in the study. But the study results were a little bit different story. There was a slightly greater than 1% reduction in deaths, slightly less than 1% lower incidence of heart failure, and about 0.5% decrease in events overall. Now, in return for these underwhelming, I think, results, 5% of the intervention patients had serious complications, which included blood pressure so low that it caused severe dizziness or fainting, electrolyte imbalances, and damage to the kidneys. The incidence of serious complications in the control group was 2.5%. In spite of this, the principal investigators stated that, quote, "It seems that the benefits outweigh the risks." Now, to me, it defies logic that he could be describing the results of this trial this way. So with that as background, let's come forward to today. In 2022, research shows that the quote unquote substantial reductions in cardiovascular disease and all-cause mortality that were achieved in the SPRINT trial were not sustained. Long-term follow-up showed that systolic pressure climbed steadily along with the loss of mortality benefit after the trial ended. In fact, median systolic blood pressure was already increasing in the intensive group by the time the study was ended, and it climbed to 140.4 by 10 years out. This in spite of the fact that many of these patients were taking multiple drugs, or at least they were supposed to be taking those drugs. According to William Cushman, who's medical director at the Department of Preventive Medicine and University of Tennessee, quote, "We were disappointed but not surprised that blood pressure levels in the intensive group were not sustained. There are many trials showing no residual or legacy effect once the intervention is stopped." Now, a logical question that I think most of us would ask is, why do we continue to organize more trials of this type? And why do we continue to aggressively drug people if this is the case? Now, it gets better. An accompanying editorial concluded that current approaches to achieving sustained lower blood pressure are not working. But instead of suggesting that perhaps we should seek options outside of just drugging people, Daniel Jones, one of the authors of this editorial, concluded that healthcare providers should be responsible for motivating better compliance of their patients. Well, exactly how does this guy think compliance could be achieved? Are we going to threaten patients? Are we going to confine them until they agree to take all of their meds as directed? Well, I guess it wouldn't be shocking based on some, people's idea. But it seems like the failure of the SPRINT trial is a good opportunity to teach people that hypertension is not due to a deficiency of beta blockers and ACE inhibitors. It almost always results from diet and lifestyle choices, which can be changed. And I think motivation for change is likely to be higher if patients are shown these types of data. The drugs are ineffective in the long term for most people. Diet and lifestyle changes, on the other hand, are effective for lowering blood pressure for most people. So why aren't more doctors talking about it? That is the $64,000 question. We're going to use these data. I'm going to put this in our library. I'm going to show it to hypertensive people so that they know what their options are. You can go the drug route, and some people need to be on drugs. To be clear, I'm not suggesting that nobody should ever take blood pressure medications, but this idea that we just drug people until we lower their blood pressure as low as we can get it and think that we're going to keep these people on these drugs. My guess is that some of these people who are taking 3 and 4 drugs just said the side effects weren't worth it and stopped taking their drugs. Thus, the blood pressure came up and the mortality rate increased as well. And nobody had given these people any other options. That's not really the way medicine should work. That's something we can look forward to perhaps when we have a different medical system, that people will be given better choices. In the meantime, we're going to keep throwing out the better choices here, as are a lot of people who are trying to do the right thing as well. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.